Hello, my name is Dr. Colin Walsh. I'm an obstetrician and fetal medicine specialist based in St Leonards in Sydney. And today I'd like to talk to you about early pregnancy ultrasound. So for women who find themselves pregnant, particularly with their first baby, it can often be extremely overwhelming to know, where do I go for ultrasounds? What sort of ultrasounds do I need? So it's useful, I think, to discuss the sorts of ultrasounds which you're going to need when you find out the good news that you're pregnant. So typically, women nowadays will have a dating ultrasound. So that's a scan that their GP usually refers them to. I see lots of patients in my ultrasound practice for dating ultrasounds. And for most patients, that's done at around 7 or 8 weeks. Obviously, if women have issues with bleeding or pain earlier in pregnancy, it's reasonable to do an ultrasound on a case-by-case basis. But normally around 7 to 8 weeks is the best time, unless there's a particularly high-risk history. And that's really an important scan to check the size of the pregnancy, make sure there's a strong heartbeat, of course, count the number of babies. We do see quite a lot of twins in our practice, and measure the baby and just try and establish that the estimated due date is accurate, and really reassure the woman and her partner that all is looking good in the early stages of the pregnancy. It's also an opportunity, because I do the scans myself and because I'm an obstetrician and fetal medicine specialist, it's also a good opportunity at that stage to briefly review any high-risk parts of the woman's history and to decide whether any medications may be needed to help support the early pregnancy, such as, in higher risk cases, aspirin or occasionally progesterone pessaries. The next main ultrasound that women usually will want to pursue is some form of ultrasound to screen the baby for chromosomal problems. Now, this is optional, and there are couples who choose not to pursue screening for their own personal reasons, and of course we respect that. But in my practice, it's fair to say the majority of couples prefer to have some type of screening. And nowadays, the most popular form of screening, at least in St Leonards in Sydney, is the test that we call NIPT. And we call it the new test, but of course, it's actually been around for about 10 or 11 years now. And that's simply a blood test. It's simply a blood test taken at 10 weeks in a specialized laboratory. You must be more than 10 weeks. And what they do in the lab is quite high tech. They take the mother's blood and they take little fragments of DNA from the baby, and they test that DNA, and they're able to tell us whether the baby is high risk or low risk for most of the main chromosomal problems, including Down syndrome. Not for everything, but for most of the main ones. They're also able to tell us to a very high degree of accuracy the baby's gender. Again, it's not 100%, but it's extremely accurate. So the majority of the patients that I see in my ultrasound practice, they will opt to have the NIPT test, which we organize for them, and it's taken in the lab downstairs in the ground floor below my office. And then the next ultrasound that we typically see patients for is what's called an early anatomy scan. So that can be done really at any time towards the end of the first trimester, but most commonly we do that scan at around 13 to 14 weeks. That's probably the best time to make sure we can see as much as possible with the baby and try and give women as much reassurance that baby is looking well. We used to do that scan at 12 weeks when it was the main test for Down syndrome, but now that women are choosing mostly to do the NIPT, we're a bit less concerned about Down syndrome in those cases, and we're just trying to maximize how much of the baby we can see on ultrasound. And if you're good at ultrasound, and I think I'm pretty good at ultrasound, and if you have good technology, you can actually see quite a lot at 13 to 14 weeks. You can see the brain, you can see the early heartbeat, you can see the two arms, the two legs, the back of the neck. You can make sure there's no bowel coming out from the front of the tummy, check the placenta, check the cervix. So there's an awful lot of structures that we can see. And of course, that's usually around about the time a lot of patients who've been keeping their pregnancy secret decide that things are looking good. I've hit the magic 3 months in old-fashioned terminology. I want to tell my friends and family that I'm pregnant. So a common model or a common pathway that I would see my patients take is they see me for a dating scan at 7 to 8 weeks. We confirm all as well. We organize the NIPT. Occasionally, we'll see them back at 10 weeks before the blood test just to do a quick check that the heartbeat is there, particularly if they're anxious patients, just for that extra reassurance. And then the early anatomy scan, which, as I said, is usually around 13 to 14 weeks. That scan takes about 30 to 40 minutes. And we try and make it a nice experience for the patients, of course. We have the warm gel, which is very popular, and all the little perks that people expect from a scan. But really, that's an important scan that I do myself. My practice, I suppose, is a little bit unusual from a lot of practices. It's fair to say in most practices, women, the ultrasound is reported by a specialist having been performed by a sonographer, but ours is sort of a a one-stop shop, and I perform all the scans myself. And I find that patients appreciate that, because not only can I talk them through the results of the scan at the time I'm doing it, but more importantly, I'm able to produce the report and give them a copy of the report before they leave.